Welcome to Dr. Dumbass and the Wounded Healer podcast.
This time we spoke with Claira Young. She is a body worker with a practice specializing in the treatment of chronic pain. Her work is informed by her own experience with a medical crisis requiring emergency surgery, which resulted in complications and years spent recovering.
Claire is a fantastic person and we had a great conversation. Enjoy. Yeah, we met, like you mentioned, we met in India, and which was really fun. And when I met you in India, like you were like a super healthy person and like doing lots of yoga and like very active. It was like what I, perceived. And so I was really surprised when you ended up like having like health problems. It was very like out of the blue. So so
Mhm.
do you want to
Yeah.
talk about what happened?
Yeah, dude, crazy story. Because actually, I don't know, have we even talked about it at all?
A
It's
little bit.
a little bit, yeah. The doctors that like helped me through this whole process were always like, "This is crazy. Like, what? How did this happen?" Um, but basically, I had a teratoma tumor, like growing inside me, obviously since like birth, in my pleural space on the left side. So like not in my lung, but like in that cavity,
Mm.
and I had no symptoms because it was growing so slowly, but and I was a really active person, like Ashley was saying. Like I ran cross country competitively. I love to move my body. And I didn't really have any symptoms, even though like this tumor was growing and compressing like my left lung. And when they finally found it, the doctors were just like so shocked because the tumor they said was like the size of like a football. Like huge,
Wow.
like massive, just
Wow.
sitting in my lower left pleural space, and my left
It,
lung was compressed to a third of its size.
wow.
And I was
It,
chilling.
yeah,
Chilling.
it's crazy to me how the body compensates for that when like it's so slow, the
Yeah.
growth. Wow.
I was literally talking with my friend who's also like in a similar field as me about the difference between like the body's ability to adapt and be adaptable versus having to like compensate. Like where is that line? It must be different for every person, but like how can you help people shift to adaptability instead of having to like shift their body and have to compensate in a certain way? Because I had a tumor growing in me for ages and was totally fine,
Mhm.
relatively, you know?
Like
Yeah.
you had no like shortness of breath or like anything.
They diagnosed me with asthma as like a kid, you know, like stress induced asthma or exercise induced asthma. But I
Mhm.
had the inhaler, it didn't really help me, so I didn't really use it. But I got
Mhm.
diagnosed with that when I was like 14, and the tumor came out when I was 23. Um, Maybe in like the last year when I was like between 22 and 23, I had like some shortness of breath with exercise, but I always just chalked it up to me being like kind of out of shape. You know, it wasn't nothing crazy.
Mhm.
Yeah,
That's really interesting. Wow.
I know. Yeah.
So how did they find it in the end? Like what happened?
um, I was commercial fishing up in Alaska on a boat, and I did like a kind of like clumsy but somewhat hard fall
Mhm.
face plant on the deck, and it burst. Like the tumor burst out of its sac, so like the kind of it just got all muddled, and that's when I really felt the symptoms of like shortness of breath. And
Mm.
my body really contracted because I think it started to go into a slight bit of shock at that point. Um, and then we just like we were out on the waters, and I thought maybe we thought maybe I had like cracked a rib or like dislocated a rib or something because I was having a hard time catching my breath. So then we went back to the harbor and took me to the doctors, and they were like they did it just like I think a I don't know if it was an X-ray, probably an X-ray at first,
Yeah.
and they were like, "You have a massive tumor in your chest."
What a shock.
I know, I know. I'm like in Alaska, like not with my people. I'm like with my captain and like my crewmates who I had developed a good bond with. But yeah, that's when the roller coaster like began. Yeah, yeah,
Wow.
it's crazy.
And they flew you to somewhere, right?
Yeah. So I was in Southeast Alaska, and the closest trauma center is Bellingham, Washington, which is just north of where I lived in Seattle. So they ended up just flying me back to Seattle because it was so funny, you guys. I was in like such like shock. I thought I was gonna go back out and like keep fishing and like go back out the boat.
With this football-sized tumor that just burst.
Yeah. They were like, ma'am, we can't even put you on a commercial plane. And I was like, oh, that's where we're at right now. Yeah, so in pretty crazy shock. Don't have the best memory of that time because obviously that's what my body and my brain was like, okay, here we go.
Mhm.
But yeah, flew me back to Seattle, and then that's when all the specialists kind of came in and were trying to like figure out what to do and how to do the surgery. And yeah, the tumor was, like I said, huge, right? And then they found out that it was also wrapped around my aorta, so they had
Oh,
to. Yeah, the removal was a pretty tricky one that they said.
For
Yeah.
sure.
Yeah.
That sounds really high risk.
Yeah. But hey, yeah.
You're here.
I'm here.
Mhm.
Long road of recovery, but yeah, we're here. Yeah.
Tell us about that recovery.
Oh man. It's a long one. Um the recovery. Still in it, I will say.
Mhm.
It's only been 4 years. Um and I think the reason the recovery has been so long is like you said, that first surgery was pretty intense.
Mhm.
And when they went in on accident because the tumor had burst. So when they went in there, they said like stuff was kind of spilling out because it wasn't in like a proper sac anymore. So they had to do some like weird positional adjustments with me. They had that specialist come in to like pull it off of my aorta. And then when I woke up from that surgery, I had a traction injury in my brachial plexus, so I
Mhm.
couldn't use my left arm at all. And so that took like a while to rehab, but weirdly came back pretty quickly. I didn't have that much support, but I went to PT a couple of times and they were kind of reassuring me that it would come back in time. And then in that recovery, I was starting to get stronger, yada, yada, yada. The arm was coming back. This was maybe like 4 months, maybe 6 months after they removed the tumor. Um, my breathing wasn't getting better. It was like worse. It was like the worst it had ever been. And we couldn't really figure it out because I was trying to like get back into running and just like get my normal routines back. And it wasn't working. I was dealing with a lot of pain. I was dealing with a lot of shortness of breath. So then they brought me back in and they found out that my left diaphragm got paralyzed. So they cut the phrenic
Mm.
nerve
Oh,
totally on
wow.
accident
Yeah.
during the surgery. Um, so then I had my left diaphragm was paralyzed. And I was trying to like use my body in a pretty active way, which was causing a lot of damage instead of like normal rehab or normal
Mhm.
recovery. Um, so that was pretty hard. I remember when they told me that, I was like, damn, because they were like, yeah, sorry, we don't really have money options for you. Like you just your diaphragm is paralyzed now. And for someone who's like 24, that was pretty tricky to navigate. I remember that being a pretty hard period for me. Yeah.
Yeah.
Um, but then I got this like pretty amazing pulmonologist, and he's still one of my doctors who gently kind of follows me right now or keeps up with me. He found out there's this like procedure in New Jersey, so like across this the country for me, and this plastic surgeon is doing something called um, nerve graft reconstruction or nerve reconstruction. So we flew out to Jersey, and I got like a second pretty intense like thoracotomy procedure, and they took the nerve from my left leg and used it as a conduit, and then took some of the motor nerves from my rectus muscle, my ab muscle,
Mhm.
and like reattached it into my diaphragm to make it like not be paralyzed again, which
Wow.
is kind of like insane in my eyes. Like what medicine can do, kind of
Oh, yeah.
crazy.
Mhm.
Like kind of crazy.
Oh, it's brilliant. Wow.
It's
Mhm.
like There's a lot of things that you guys know this, but can be worked on. But the fact that that I had the ability to do that was insane.
Mhm.
Um, and I'm happy to report I just did a pulmonary functioning test like 2 months ago, and from my breathing abilities, it seems like the diaphragm is back online. This left diaphragm is back online. So
Wow.
That's amazing.
I know. I'll keep you guys posted on how that goes. So hopefully
Uh,
my breath starts to get better and some of my like structural pain stuff starts to get better now that I have like my pressure system is kind of coming back into play. Or like normalizing a bit, I should say. It's always been there. Yeah, so that's kind of the recovery. And obviously like bunch of trauma, a lot of PTSD, but
mhm.
we're here. We're we're trucking along. Yeah.
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 Mhm.
My God. Yeah, like combining that technology with your body's like innate ability to heal and like, take that nerve from your leg and then somehow it's just like, okay, this is part of the body. We're going to make this work.
I know. Isn't that
That's,
crazy?
the brilliance of medicine, but also your body.
Mhm. Yeah, and I talk about that a lot because right now I'm working with someone privately to help me figure out like how to breathe again. Like I've been breathing so weirdly for 4 years and probably even before that because I didn't really have capacity to breathe deeply into my low left ribs. So
Hmm.
I'm working with someone who's a Pilates instructor on like trying to find that again and with myself because I'm a body worker so I like do that myself. And it's it's learning like how to make that innate again. Does that make sense? Like breathing is something that's so like natural to our body, but like I lost that ability for a little bit and now I'm like having
Yeah.
to relearn it. I feel like a child sometimes. Like I'll do certain poses or certain like breathing with movement and I can't figure it out. Like I don't have like the brain to body connection.
Hmm.
And yeah, it's a very humbling experience and goes back to what you're saying, Sam, where like the body has this really unique ability to want to find like function for itself. Like my brain is trying so hard to figure it out again because it knows like when it finds the right position and right breathing, it feels so good. The body wants to go back to like what I consider like center, home, your powerhouse, like this like middle breathing line. So it's a really cool experience, especially for someone who I like help people figure this out themselves in like my private practice and then figuring out myself and my own body. What cool research. Such cool
Hmm.
research.
Mhm.
So, what is your private practice? Or what do you do with, like, you're obviously recovering and then using that to teach other people or do things with other people.
Yeah. So, what is my private practice? Well, like licensing wise, I am a massage therapist. So I have a license to touch. I use the term body worker. I think that's a bit more like inclusive to what I do. And
Mhm.
basically, what I do and how I like market myself is I help people with pain, like pain management. That's my big thing. Specifically around chronic pain management is my big one. And then also I try to help people who have similar experiences. They live on like the chronic illness spectrum or the disability spectrum.
Mhm.
Basically like helping them find a way to get back into relation with their body when their body isn't like what you considered able-bodied anymore. And like when that happens a lot of times you encounter and have to manage pain because we don't live in a world that's really adaptive to that experience.
Mhm.
Um, so that's my big thing. And I do structural integration work with a mixture of just traditional massage therapy, which is more like orthopedic work. So just like working the muscles and then working the fascia. Obviously, you can't not work the fascia if you're a body worker. And helping them get their structure more in line with their brain is a big thing, is what I kind of say that what I do. And
Mhm.
then help people with triggers because a lot of, as you guys probably know this, a lot of pain is top down or like the top down regulation from brain to body gets pretty haywired.
Mhm.
Um, and so help people figure out how to like soothe and calm their nervous system so then they can like rewire and retrain their brain to
Mhm.
not have their pain be so loud in their body.
Yeah, that's what I'm interested in. Like,
Me too,
because
dude. Me too.
it's such a big part of like family medicine or family practice. Because
Mhm.
that's, yeah, how do you change or shift those pain signals, I guess? What have you learned with your experience?
Yeah, I mean, I'll be totally honest with you. Like, I've only been in private practice working with people who manage pain and who live on the disability spectrum for like 2.5 years. So I'm pretty new. Like, I'm pretty young in this profession in general. And then I'm even newer in like pain management. Um,
Mhm.
and you guys, I don't know what kind of training you guys get in this or like what the discussion is for people who have MDs around pain management. But me just going through the like the primary literature that's out there, it's all over the place on like what you can and should do for pain management for people. um what I really focus on, like I was kind of saying before, is like there's always going to be a component of, if someone has chronic pain, that the top down, like our brain is hypervigilant, it's too aware, it connects like emotions and fear with the sensation, the bottom up sensation of like pain perception or nociception. So
Mhm.
those lines you kind of need to help people understand, right? That's the first one, is like help people understand that, and
Mhm.
then help them rewire, because our brains are really plastic, right? Neuroplasticity is so rooted in science, and there's an ability to change neural pathways or shift the dominant neural pathways. So it's like communication, and then on the table, we just talk about sensations, affect, and figure out, where is the pain coming from? Is it really because your leg hurts? Is it because you're holding tension because you're afraid? Is it because this memory is stored somewhere in the fascia in a physical place in your body? So we work through that. And then a lot of times pain is from like structural changes, right? Like it's a bottom up thing, if someone, like I'll use me as an example, like my pressure system got really effed up when I was had that paralyzed diaphragm, and I didn't know how to manage or pace my activity very well when I needed to. I needed to slow way down, and instead I was trying to push, and that was kind of the advice I was getting from people, specifically doctors who were kind of managing my care, because I
Mhm.
don't think they had enough time to kind of like break it down with me on like what it meant to push, because they didn't know that I was a really active person. So I was like, yeah, go ahead, do your like go back into your life. And I shouldn't have been trying to run multiple miles and garden and landscape and like do yoga, do Pilates, go to my PT. I couldn't have done all that in a week, with the level of like disability I was managing.
Mhm.
So pacing's huge. Telling people to slow it way down so they can figure out like what is their edge of their body's ability. Like you got to find out what that edge is, and then you can figure out how to manage that so you don't put your body's state in pain. So that bottom up stuff.
Mhm.
Kind of how I help people and like work with that in my private practice.
Yeah. Well, that's the, I mean, that that seems like the best direction to go with that, like really letting your body lead the way, because it's, I mean, it needs to get back to whatever it, or get back to whatever functional abilities it had before, or maybe not even getting back to that. That might be the wrong language, but
Yeah, or like finding the new, whatever their
yeah.
new normal is. That's a big thing. It's
Mhm.
like, what is your new normal? But it's hard to do that, especially if some of your changes in your body comes from a surgery or comes from like intensive medical treatment. That's really traumatic for the body. And right, the natural response when we go through like a really traumatic event is to go in a survival state, which is to dissociate, to kind of numb out.
Mhm.
So how are you supposed to get in your body if like that's like, how do you understand your pacing if you're not in your body?
Yeah.
Mhm.
You know what I mean?
You don't. You
Like you
couldn't.
don't know what you're doing. Yeah. And then you get advice from people to just go back into your life. And that's, no offense to the people giving you that advice, because they don't have enough time to tell you exactly what to do, or like they don't have your full history. So you listen because you think that's what you should do, and then you get yourself into more trouble, and then you further strengthen the pathways of chronic pain.
Mm-hmm.
Yeah, it's like a kind of catch-22. It's like, where do we find that break?
Yeah, bit of a vicious circle.
Yeah. Yeah.
How did you start to get back in your body?
Well, I mean, Ashley, you know this too about me, Ashley. It's like I've always, like, when we knew each other, I was pretty deep in like my journey of asana yoga, or like movement based yoga practice, and that was a really lovely way for me to get into my body. And then I was also really interested in meditation, like a sitting meditation practice. Um, so I had practiced mindfulness based meditation, and then also I had the opportunity to do a couple like 10-day silent sits through the Vipassana
Oh, wow.
lineage of meditation. And so I feel like I have always liked to be in my body. That's been like a pretty big thing for me since I can remember.
Mm-hmm.
Um, and then when I was kind of going through this crazy recovery, um, I figured, like, I learned that I was really out of my body. Um, what was interesting about that, when I was like really out of my body, I actually had a moment with myself when I was like, this is okay. Like, your body is going through a lot right now. It's okay for you not to be in your body, which was kind of like a revelation for me. You know, like
Yeah.
sometimes your body's in a state where you shouldn't be in it because it's not healthy, safe, comforting. It's in a lot of pain, you know, some of those words.
Yeah.
Mm-hmm.
There's always a good reason people leave
Yeah.
their bodies.
Mm-hmm.
Yeah. Yeah. Like, I don't want to bash being dissociated or like not being in your body, because that is literally a survival state. It allows you to like survive in extreme forms of like trauma or pain. Like,
Mm-hmm.
Mm-hmm.
whoa, incredible that our brain and our body can do that.
Yeah.
Um, but then yeah, coming back into my body is pretty new. Um, to back up a little bit, when I had that second surgery to get the nerve graft in, they also put in a pacemaker for me to help stimulate my diaphragm before the nerve grew.
Mm.
Um, and so I had like wires going across my belly and then coming out of my belly on my right side. And because I'm young and like kind of dumb, and I didn't get a lot of guidance on how to manage, you know, wires coming out of my belly, I got infected.
I mean, not.
No one told me I mean, I had such little, I was, yeah, like, "Yeah, here's some things to clean it." And I was like, "What?"
Yeah, there's
Yeah.
wires coming out of
Yeah.
me. Like, what? At 23 years old or however old.
I was
Yeah.
20, like, I think I was 24 at the time, but still, like,
Yeah, that's crazy.
um,
Mm-hmm.
so those got infected, like, man, the first month that I had them, and I obviously wanted them out when the infection happened, right? Who wouldn't?
Mhm.
Um, but the doctor who put the pacemaker in and who was part of the nerve graft surgery was really wanting me to keep them in, to help the diaphragm get stronger before the nerve came in, so I didn't atrophy more, because there is a point of no return with atrophy. Um, and so I had an infection that I had to manage for like a year plus, that was slowly getting worse and worse and deeper into my belly, and I
Mm-hmm.
was slowly getting more and more sick. And
Oh
so
my.
that period, I was like very much so, I kept on like coming out and out of my body. Like, I stopped my sitting practice, I stopped a movement practice, because being in my body was like not safe, you know?
Mm-hmm.
Yeah.
And that's when I kind of learned like it's okay to be dissociated sometimes. I think it's like, especially like in wellness right now, people are like, get in your body, get regulated.
Yeah.
I
Yeah.
mean, mm,
Uh,
and it's okay to not be all the time.
yeah.
Mm-hmm.
So now I'm coming back into my body, and the big thing is like, whoa, my breathing, wild. Like, how I breathe is very unique and different. Um, and getting it to kind of normalize and like slowly moving the scar tissue from the inside out, um, is a really embodying experience, because it's a little uncomfortable, but yeah, it's,
Can
you know,
Mm-hmm.
yeah, telling myself it's like okay to do, and like I think I have good education around how to get myself into a very restful state or like a safe state. So then when I do work on my like pain boundary, I don't further trigger my chronic pain. Instead, I'm helping it heal and like rewire.
Yeah.
So that's what
Yeah,
I'm
finding that balance, it seems, between being like it's okay, like almost comforting or nurturing your body,
Mhm.
and then pushing into that boundary like you said.
Mhm.
That must be a day-to-day balancing act.
Yeah. And I don't think I could have done it alone. Like I've had so many lovely people who work in healthcare kind of like help me figure it out. Um and me kind of working on the outskirts of healthcare has helped me find those people. Um but yeah, it's a lot of people don't get the resources, and that's my big thing. That's why I'm kind of like shouting into the world right now. Is like there are people out there who can help you with this management. It's
Mhm.
not standardized yet, but I really hope in like our lifetime it gets more standardized because it should. I mean, especially if you guys are in family practice, like do you have any trainings or are you learning more about how to help people with pain management?
There's definitely more.
Yeah,
Like I know here in Saskatchewan we have some pain pathways and stuff that are improved definitely
yeah.
in the past few years from what they have been. Um, and I think like throughout my residency we talked about pain, like if we're like approaching it right.
Mhm.
Because I mean the old way of approaching it was kind of, keep like push through, keep going,
Yeah,
and then medication.
yeah.
And whether it's medication just to take away the pain, like an opioid or something, or medication to work on the neurotransmission,
Mhm.
it's,
Mhm.
it's not the whole picture. Like that emotional and pacing part of pain, I think
Yeah.
that's where we need to be talking more.
Yeah. And like so that's you said was kind of the older way of doing it. What is like what were you taught is like the newer way to do it? Were you taught about like pacing? Were you taught about like the emotional and mental side of it? No.
Like it was touched on,
Okay.
like that
Yeah.
there's more to pain than just a physical thing,
Yeah.
but it wasn't in depth, I don't think, that I
Yeah.
remember. What did you experience?
Yeah, I can't remember exactly what I heard in medical training and outside of medical training. So
Sure.
I can't exactly remember, but there's
Yeah,
still definitely a way to go.
because there's a lot of like outside reading and things beyond what's just taught in the curriculum that goes on. So I
Yeah.
feel like I've gotten a lot of information about pain from a lot of different sources.
Mhm. Yeah, that's what I mean. I feel like it's bouncing around so much. Like there's a lot of really good research coming out and there's a lot of good people talking about pain management, but it's all like in these like small little like corners around, like these like little web bits that you can find and you going off tangents or you like find this specific person or center that like does focus on pain management and like sees good tangible results versus like the standardized way that we look at pain. Like that's what's missing because like in my like trying to figure out how to manage my pain, I got more traumatized. Like I saw medical providers who worked in the chronic pain clinic who further traumatized me and like worsened my triggers, which just made my
Oh.
pain worse. But they were doing that kind of like older way of treating pain, and it just they didn't have time for me to like know my whole story. They just gave me medication and sent me on my way. They didn't even tell me about pacing the medication. Like they gave me an SSRI and like they're like this is what probably would help and wasn't the right dose. They didn't tell me how to pace up or down. So I had to take myself off it, which I know you're not supposed to do. But and like they gave me an SSRI without also referring me to see a psychiatrist or like have a therapist or counselor like walk me through it.
Hmm.
Crazy. What?
Hmm.
Like in
Yeah,
my
it's kind of
opinion, that's
like
like
just,
malpractice, but, like, that's what? That's so crazy that was the standard. That was normal.
yeah.
Yeah.
Mhm.
Yeah.
Yeah, just kind of slapping one of those tools on it and being like, that should fix it, you know, on to the next person.
Yeah.
Mhm.
Yeah. Yeah.
Mm.
It just like when I hear you guys kind of talk about in a couple of your episodes, I think one of the first ones about how like your experience through like medical school is like a very traumatic thing. Like I wonder how many doctors kind of like stay in that what we were talking about, like the numbed out dissociated state because they've been traumatized and then they feel like that's the way they need to exist. And then 30 years later they're giving a random person like a pretty intense drug and they're like, "Oh yeah, you'll be fine." And like send them on their way. Like I wonder
Mhm.
Mhm.
where those lines where they come from a little bit.
I think that's common.
Yeah,
Yeah.
I think that's a big part of it.
Yeah. It's an interesting one for sure. Like
Mhm.
how much are people talking about who like exit medical school on the experience that you guys had? How many people are talking about in your experience like talking about how we teach doctors is maybe not the most conducive for having them then help people how to like heal and feel better and take care of themselves.
I think it's definitely being talked about.
Mhm.
Um, I'm not. I feel like I don't have my finger on the pulse with that. I'm not sure, like how common it is.
Yeah.
Um, but I think it's becoming a lot more common.
Yeah.
Um, and I mean, even through medical school, like people do talk about how it needs to be changed or different things need to be
Mhm.
changed.
Mhm.
There's a lot of good people working towards that,
Yeah.
but
Yeah, and then there's a bit of like, well, doctors who have trained, and not all doctors are like this, but doctors who trained a while ago will say things like, "Oh, back in my day, it was so much worse. It's not. It's fine. It's great now." Blah blah blah. So there's like definitely, it is being talked about, and then there's a bit of pushback from some people because, like you mentioned, they were traumatized. Like they went through a lot, and then that's not a helpful way to approach life. Like that, I was, traumatized worse. So
well, and
yeah,
Yeah.
part of that trauma response is like toughen up, like
yeah.
Mhm.
you harden yourself more towards people's pain and people's experience, which would lead to that kind of brushing off
Mhm.
um,
Totally.
approach you probably experienced at that pain clinic,
Yeah. Yeah, definitely.
because it's kind of like, oh well, deal with it. People get like that, and I understand why, but it's not helpful.
Yeah.
Yeah, it's just very interesting to me cuz like we medicine is like I said incredible. Like it can bring a diaphragm back from being paralyzed. Like that's
Yeah.
what a crazy cool thing that we can do. But then like what's the recourse of that, you know? Like I've had 3 thoracotomies now, which is like a very intensive surgery and um just like there's not that much recourse on how to help people rehab from it.
Mm-hmm.
You know, like I wasn't even after my third thoracotomy, I wasn't even referred to do physical therapy. You know,
Oh
like
wow. Okay.
that's crazy in my eyes. Like no form of rehab even considered. I was thankfully, I mean, even my first one, the most intensive surgery that I had, I was referred to go to physical therapy just for my hand, not even for like general physical therapy. And like
Mm.
that just seems really crazy in my eyes that we're not like that seems like a very simple step that could be changed or like put in place to
Mhm.
standardize like if you have any type of surgery you have to go to physical therapy and it's just not yet and that's just still hard for me to reckon with. Like that's why I'm like, what is going on? What are you guys getting taught? Like, like
Yeah. So
what's
there's
communicated?
definitely like there's a recognition that that should happen, I
Mm,
think. Public systems often can't meet the demand,
okay, so it's a
or don't
demand
have the
thing.
capacity, I guess. So
Yeah.
then it's kind of like, well, if you want good physiotherapy, you need to pay for it.
Mm, yeah.
Which I think, I mean, that's probably got a lot to do with funding choices and, things like that. Um,
Yeah.
but it's interesting what I've thinking about is like how that surgery, taking that medication, like that, I mean, it's inherently breaching your body's boundary. It's like,
Mm-hmm.
it's going right in there.
Yeah.
And so that can be, to varying degrees traumatizing or overwhelming.
Yeah.
And I think we need to like have more of an approach where we just inherently understand that about conventional medicine.
Mm-hmm.
Yeah.
Like if you're taking a pill and putting it in your mouth, it's like it's going inside your body. Like it's not just talk therapy or something. Like it's, it actually does breach whatever boundaries are
There's a
there.
biological change that can happen and that will happen. Yeah.
Mm-hmm.
Hmm.
Yeah. Yeah, I think about that a lot too. Whenever I see people in my practice who've had a surgery, I always tell them like baseline, that's like a physical trauma to your body because like your body doesn't really give consent to be cut open in a very safe and like structured way, but it
Hmm.
still doesn't give consent. And I think like you were saying, learning ways to like to understand that both like as a patient and then also as providers um is where we need to kind of like move towards, which I think is happening. Like, what do you guys think? Like, I think that's happening. There's like a pretty good recourse happening where we just have like an understanding that like the brain and the body are connected. Our nervous system can be greatly affected by so many things, like all the time throughout our life. Trauma is talked about pretty openly. I think in general, people are getting more emotionally intelligent, able to talk about what they feel and their thoughts. Um, are you guys seeing that as well?
I feel like I am.
Mm-hmm.
Like,
Yeah, okay.
Yeah.
That's like the hope that I like hold on to a lot when I'm
mhm,
working with people. It's like things are changing. We're getting better at understanding this, both
mhm.
as people receiving the work and as people who like provide the care. Which is like, thank
Mm-hmm.
God.
Yeah.
Mm-hmm.
Yeah.
Do you want to like break down that mind body connection or like how you see it or just kind of talk to that a bit?
Hmm. Yeah, like I said, I can talk, I think, a bit more from my experience. And like, I've
Yeah.
been studying this now for, like I said, a few years on the like research academic side. And then also, I've been like, studying it my whole life in my body.
Yeah.
Um, you know,
Yeah, a 10-day like silent meditation retreat. That's no joke. That is
I would
big.
encourage anyone and everyone to do that if they can. If they're in like a good space in their life, it's it's very calming, which is surprising to say. It gets
Mm,
really crazy and then it really calms you down. You're like, oh, okay. I
yeah.
understand like what the important things to focus on in life are, which is nice.
Yeah. Grounding.
Um, yeah.
Mm-hmm.
I think the mind body connection, what I talk about a lot with myself and with my clients is like our brain or like our frontal brain, prefrontal cortex gets in the way of like that connection. I think as humans and as we've evolved, um we've taken logic a little bit too far to be the truth of like how we should live. I think
Mhm.
we have let go of like instinctual knowing, gut feeling, what is your heart saying, right? Because that all has a resonance, that all has electrical signaling. It's very biological or like mechanical, however you
Mm-hmm.
want to say it, in the ways like make sense to this like logic center that we have. Um, and when we let go of those instincts, I think that's where we get ourselves into trouble a lot. You know, you
Mhm.
go down like maybe a bit of a weird path in your life, or you, like me, run yourself into problems with like pacing what your body can do. And then that gets you like going down something that is like not considered healthy. You deal with pain, you deal with suffering. Um, and then when you can find the like relationship between mind, heart, gut, I'm not quite sure like the what those like different sub like categories are. Um, that's when you can like find happiness, maybe is the right word. I don't even know if happiness is the right word, but
Like
um
peace.
peace. Yeah, maybe peace is a good one. um I always call it, like, when I find it for myself, it feels like home, or like it feels like my center. And I think a lot of people resonate with that, at least in my private practice, is like that, those words. Like, it just feels right.
Mm-hmm.
Um and then you can, yeah, then you can move through the world with like peace, understanding. You can respond to things, not like react to things. You have some like body intellect on your choices instead of just like logic, because logic is, we made that up. Like, humans made
Yeah.
that up.
Yeah, it's a tool.
Mhm.
Cool. Pretty genius of a tool that we've evolved with, but it's still just like a tool, like you said. Um, yeah, I wish more people lived more in tune with their like body and mind connection. And that's, yeah,
Well, and
Mhm.
that's
it's
my take on
hard
it.
to live that way. Like what comes up is like as I'm rushing to get over here because I didn't plan time very well, I found myself getting like reactive with other drivers. Because they're like so slow. And it's like they could have turned like 3 times over and they're still just sitting there. And I'm like, I've got a meeting, I gotta go. um so I can be yeah, like your
And
heart
then we
rate
got
goes
here
up,
all
there's
at sat down at the
tension.
same
Yeah.
time.
Yeah. So we were synced up on some level.
Yeah, and like that's like a resonance that this might be a bit of a tangent, but like that's, the world is set up around us, I think, to not have us be as in line with that like slowing down body to mind connection. So like you
Hmm.
said, it's like a constant practice to
Yeah.
come back into that. And it's like hard work. It's like really hard work to constantly have to like come back to that like multiple times a day.
Hmm.
And obviously it's a practice, so it gets easier and easier the more you do it. Um but like, when, like you said, when you're driving, that's a very like stressful state to be in. And we do it all the time. You know, we've
Hmm.
normalized that. Our phones, they pull us out of that like kind of body mind connection. And I'm so grateful we have the technology of the phones and like smartphones.
Hmm.
Like, I don't know where I would be without my smartphone, but that pulls you out of that. So it's like, it almost feels like culturally we have to prioritize coming back to that like body connection more and more, because as technology grows and as like we evolve as a human species, we create systems that kind of pull us out of that.
Hmm.
Yeah.
Yeah, we're not very focused on the like body or animal parts of who we are.
Yeah. We've like
That's
evolved too
changing, like you
fast.
said
Mhm.
though.
Yeah, it's like we've evolved too fast for our like biology.
Yeah.
Yeah. Yeah, it's a funny one to be into. But like, when to throw coming back to like my kind of story and what we've been talking about at the beginning part of this is, when your body changes, you have to find that again, because it is like a restart. It's like a restart with your body because it's shifted, or it's the wiring up here, if you've gone through like a traumatic experience, has changed and continues to change if you have PTSD, because those triggers happen over and over again. Like, you have to come back to your body if you want to find healing.
Hmm.
And we all deserve to heal. Like, that's such a, in my opinion, is like an innate thing for humans. It's like your ability to heal.
Mhm.
Hmm.
Um, yeah.
What advice would you have for people to like coming back into that body, like that restart?
Mm. I think that kind of depends, because remember how we were talking about like being associated like as a survival state that's okay to
Hmm.
be in. So for some people, like if you are super triggered, or if you've had repeated trauma, which a lot of people have, um, getting into your body isn't safe. And if anything, it can be more triggering and actually can be dangerous for you, or like can send you to be dysregulated. So a lot of times I tell people is like, learn about your emotional intelligence. So that probably means like finding a therapist or like doing a deep dive with your support system, your community, to start to learn about like what your thoughts and your feelings are. And then if you feel like you're in a safe space with that, then you can figure out how to like get into your body.
Mm-hmm.
And the big one is I always just tell people like find your breath, because that's like, oh, we're doing it all the time. It's like, can you find the details of it? That's what I usually start with. It's like, what are the details of your breath? Like, where is it coming in? How wide is it? How deep can you make your breath? That's like a lot of focus for your brain, which our brain needs in order to like get into the body. You need to give it like a
Mm-hmm.
kind of a hard task. Um, and then trying to be present with that, you know, like not being in the past, not being in the future. Try to stay present with where you are. That can be through like working with your sensations, deepening the breath, changing the breath pattern.
Mm-hmm.
And that just strengthens your ability to come back into your body. You're making it more of like a natural habit pattern for yourself.
Yeah. And then over time, that internal sense of safety builds.
Yeah, yeah, because you're teaching yourself what safety is, and you're reminding yourself what safety is. You're like strengthening those pathways.
Mm-hmm.
Yeah.
Yeah, because what has struck me about that before is it's like you need to find safety externally to find
Mm-hmm.
it internally, or
Yeah.
this is so that's where for me, like, trees or artwork or plants or things like this, where you can actually go, okay, I can look at this thing and feel it in my body as a good sensation
Mm-hmm.
to try to pull in. um
Yeah.
it's important, I think.
Like co-regulating a bit with.
Yeah, I guess that's what I'm getting at.
Yeah. Yeah, they say that a lot. Like being in nature, you know, those studies that like kind of blew the world. They're like, wow, being in nature is good for your mental health. You know, like, yeah,
Wow.
crazy, huh?
Wouldn't have guessed it.
You know, isn't it so funny? I think it's so funny when like these like human systems we've created, like academia or like primary literature papers catches up with what like has been known by like
Mhm.
Mhm.
the planet or like um people for so
Yeah.
Yeah.
long. And we're all like, whoa.
Yeah.
Crazy.
Oh,
We're
going
like,
for a forest walk makes you feel better. Like,
I know.
wow, revolutionary.
I know. Yeah, I think it's like humans, we're just funny, man. We like create
Yeah.
these silly systems for ourselves and then bang our heads up against the wall when they don't work. We're like,
Mhm.
what? What do you mean? And I feel like health and medicine, we do that a lot. I think we do that a lot because we're trying to conceptualize this like magical being of the body, which is like this huge ecosystem with very
Mhm.
complex systems in interaction with each other, on top of the environment also having interaction with our bodies as
Yeah.
we're evolving every generation. And then we try to pretend like we know what we're talking about. And we do sometimes.
Yeah.
Because, like I said,
Oh,
incredible things can happen in medicine, but we don't know everything. But I think culturally, people think doctors know everything. And it's like, that can
yeah.
get kind of
Mhm.
tricky.
Mhm.
Mhm.
Yeah. Like, how often do you guys say to people when you're practicing, like, I don't know?
Pretty,
Like, are you
Often.
guys taught?
very often.
Often.
Yeah.
Yeah. Are you guys taught how to say that or like how to talk to people about that?
Yeah.
That's
Yeah. There's
cool. Okay.
definitely, yeah.
What was
There's
that
definitely
like?
I guess some of it is you have to figure it out for yourself, but it's like being honest is important, and also
Mhm.
like you have you do have time. Like that's a big thing. Like you don't need to just solve every problem right then and there. Like some things do take time, and
Yeah.
yeah,
Hmm.
saying when you don't know is important.
Yeah. I mean, it's, I guess, humbling in a lot of ways, where it's like, oh, we learned or were trained in this certain way, then to realize, like, a lot of the time I'm just saying, I don't know. Let's dig into this deeper. Let's
Yeah.
learn together. Let's figure this out. Um, it's interesting. It just shows that the more you learn about anything, the less you
Well,
know about it.
yeah.
Yeah. Oh, I really feel that one. The more I learn about like pain care and like how the pain is processed in the body, I'm like, we actually don't really know what we're talking about yet, or like it's not like one thing. There's many avenues to how pain is processed and caused. But
Mhm.
yeah, I mean, I'm just really curious to talk to doctors, especially practicing ones, about that idea of saying I don't know, because a lot of the people that I do see who have gone through the medical system and have not gotten a lot of support. I mean, the term medical gaslighting is really common, right? Because a lot of times people either have their symptoms and pain dismissed, or the doctor says it's this when it's definitely not. Like they act like they know what it is instead of saying maybe I don't fully know what's going on, or like I don't know. So
Yeah.
yeah, just
I do see that happen a lot
yeah,
too.
Mhm.
like
Where it's like, instead of listening to someone, and kind of, maybe guiding them through to find where something's gone awry, it's like,
mhm,
no, it's this. It's very top down, like
yeah,
trying to tell someone how it is. And I think that's got a lot to do with ego, or like the fact
mhm,
that we're supposed to be experts.
yeah, yeah. It's and that probably goes back to the whole schooling thing that I've been kind of asking you guys about on and off through this conversation. Is like where in the schooling is are people taught to have some humility with medicine? Like medicine doesn't know everything, or like people are coming to you and they're like some of their most vulnerable states. How are you taught to hold that? And like, are you set up in a system that allows you to hold that space? Maybe that's the bigger thing. Maybe you're not set up
Yeah.
to hold that space. And
I,
like,
I think that's the bigger thing.
yeah,
Um, because people want to do the right thing for people,
yeah,
and like treat that vulnerability, um, gently, and have it go in the right direction. um, but when things are set up to see people for a short period of time, to really be over invested in logical thinking and biomedical thinking, um, I mean, it's inevitable.
mm,
People's vulnerabilities aren't going to be held the way they feel that they should be, or could be, for the
mm,
most for it to be the most productive. But that's not saying they can't be. And
yeah,
there are always like windows where it is. But I
yeah,
think it's also like, how low is the blood sugar, or the doctor's blood sugar? Is it the end of the day? Are they this or that? Like, you're
Mhm.
more likely to be dismissive. And if I dismissive, I try to be like, I don't have time right now to deal with this type of thing.
yeah,
Please come back like another point, book a longer appointment or something like this. um so there's more time to get into it. But it's like, it's almost inherent in the way it's done, that people are going to be dismissed at
mm.
times.
Mhm.
Do you think that'll change, get
I
better, or think it'll get worse before it gets better?
might do a bit of both.
Yeah. Yeah, I have no idea.
Well,
Yeah,
because it depends so much on how we set things up.
yeah,
um
yeah.
so payment models for physicians are shifting, so it's less of the fee for service, and it's a bit more like flat rates that you're getting no matter what, or the quality of care is compensated versus the quantity of care. um
Great to hear.
so that's a big step in the right
Huge,
direction.
huge step in the right direction. Yeah, something I think a lot about is like we don't, like you said, it's like for service, like you get paid based off of like how many people you see. It's like that's probably not the way we should be going.
No.
So it's good to see
Mm-mm.
it shifting. Yeah.
And that's, I think, a priority for all the for family medicine across Canada anyways,
Mm-hmm.
um to get rid of fee for service.
Do you? I know, like, yeah, we like I live in the U.S. and you guys live in Canada. Do you? Is that a wide topic being talked about, or does this feel like a kind of new emergent thing being talked about?
The payment,
Yeah. Yeah.
um it's more emergent. I think it's been talked about for a long time, but now we're actually seeing action.
Okay. Yeah.
So there's provinces that are completely doing away with the fee for service stuff.
Yeah.
Um, Saskatchewan included. So that's, I mean, that's a big step, like where it's actually action. Like people have been talking about it for years, probably long before I got into medicine.
Wow. Yeah. I mean, the hope is because I think where a lot of people get into trouble is there's a like shifting away of trust from doctors, especially when you live on the spectrum of like having a chronic illness or a disability where you're forced to reckon and see specialists a lot or like all the time, and then you have to deal with the repercussions of not getting proper care and services. So trust has slowly been going down and down and down. I
Hmm.
think that shift away, what you're saying is like where providers can have more time with patients and they're not burnt out will
Mm.
help kind of rebuild that trust, which is so important because medicine needs to be a part of their care.
Hmm.
So it's comforting to hear that you guys as doctors are seeing that change, even if it's in Canada and not necessarily in the US, but like hopefully that ripple can happen, and maybe it is happening in the US. Like I said, I just don't know.
Well, yeah, in the US, it's probably a little bit more like depends what clinic you go to.
Yeah, yeah, because they're yeah, different hospitals are that's a different beast.
Yeah.
Yeah, yeah. Yeah, because trust is so important, and I think a lot of people have lost trust in the medical system when it's incredible. It does amazing things. Like medicine can save lives over and over again,
Hmm.
um,
Oh,
and
yeah,
help
we need
people.
it.
Yeah, we really need it. But it obviously the system of it needs to change. That's really clear.
Hmm.
Mhm.
Yeah, yeah.
Yeah, speaking of trust, I guess like you've gone through this journey of having to come back into trust with your body. Like your breathing, like even just to be like to be able to breathe.
Mm-hmm.
That's a pretty profound thing to have to do. And I think many people don't experience that on that level.
Yeah, humbling. I think is the big word with that one.
Hmm.
Um, and like coming to terms with the fact that like we are kind of just like sacks of like meat and water, you know? Like talking about the like
I love
logic
that.
center, you know what I mean? Like the logic center thing. Like we think we're these like really intelligent beings that we've created these like amazing vast systems, silly systems, and like when you have to reckon with the fact that you're just a sack of water with some meat in it, it's humbling. And the thing is like most people will face this some time in their life, right? Like as we age, our body kind of naturally deteriorates, and then you throw in life, and like life will give you those curveballs where you have a big life event that like makes you. I mean, the simplest one, you guys know, is knee replacements are so common. Like if you have a knee replacement, like almost everyone has to do that in their life. Um, you have to reckon with it. You have to reckon with like your body won't be able to do everything you want it to do. So learning how to like listen and trust that your body is sending you the right information instead of the other way around. I think that was a big turning point for me is like I thought my pain or like what my body was telling me was like wrong or like it
Mm.
wasn't
Yeah.
good enough. Like why can't you keep up with what I need? And I had a body worker who's specifically a craniosacral practitioner tell me like no 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 like your pain is like you need to listen and respect that. It's like your body telling you that something's wrong, something's a little off, not that you need to stop, but it needs an adjustment. And it
Hmm.
was like such a simple reframing that like had huge effects for me because it got me out of my like front brain and got me like listening to my body, which is my brain, right, your body, your nervous system
Mhm.
is part of the brain, the control
Hmm.
center. um like I said, more people need to be saying that. Like I wish I can't go back in time, but I wish some of the first people to work with me, like some of the surgeons or some of like I had a PA who was a pain specialist who was helping me with like my opioid, like coming off my opioids, what was telling me those things. Um, so I didn't have like 2-3 years of like suffering pretty bad with pain because I was just
Mhm.
told to like go back into your daily activities. Like, oh, what you feel is like nothing. It's just normal recovery pain. It's like that wasn't true. I should have had someone help me, guide me better with like listening to the body. But if, like we were saying before, if you work in a system where you're constantly being asked to like overwork, see too many people, work really long hours, not sleep very well, how are you supposed to give that advice if you're not in your own body? If you don't know what it's
Mhm.
like to listen to your body, how are you supposed to give that advice that is so necessary for rehab and recovery?
Yeah.
Yeah.
Another piece that comes up there is many people practicing medicine haven't experienced
Hmm.
things like this.
Yeah, that's a good
And
point.
experience is probably the most important teacher,
Yeah.
or one of the biggest ones. So it's like, I mean, how can like a 27-year-old, like, or 28-year-old brand new doctor know this,
Yeah.
like, on a deep enough level to be able to confidently, like, guide someone else through it?
Yeah.
So it's like some of it might be like that's got something to do with it.
Definitely has something to do with it. That's why, like, hopefully we see change in education, especially for doctors.
Mhm.
Like, there's
Mhm.
enough science now behind this, like, idea of, like, mind-body connection, like, being in your body, understanding that pain is top down and bottom up. Like, there's enough, in my opinion, literature out there that I would hope to see change soon. Or maybe not soon because I tend to be an impatient person and I'm a young person, so I want, like, more change, and
Mhm.
I'm reminded that, like, change happens very slowly. Um, but it's like the humanistic characteristics of wanting to help people and care for people. All of us have that, right? Especially if we go into medicine or we go into healthcare. Um, but like, how can we utilize that and how can we use that in the system that we work in? And if we don't have a system that really like allows that, we're gonna get people more sick or more into trouble than helping them find the quality of life that they deserve after they've gone through crazy medical interventions that saved their lives. But that's not, you can't just like be like, I saved your life, you're good. That's,
Mhm.
you I personally think healthcare and medicine should want to do more than that, which I don't know if I don't know if that will happen, but we'll see. Yeah, we'll see.
Yeah. I think it takes time.
Yeah.
And I think it does. I think people are inherently want to help each other, and I think we probably need to, like, people need to teach each other the ways they need to be helped. I think
Mm.
in some
Mm.
context, because it's hard to know. Like, you have two experiences that are vastly different coming up against each other.
Yeah.
Like, that's going to result in a lot of miscommunication or misinterpretation, or, all kinds of different things.
Yeah.
Yeah.
Um, yeah.
Conversation is so important, like hearing just different people's perspectives. Like I think that's really like the way forward is through conversation and listening. Like that's very important.
Yeah. Like, are you I feel like I'm asking you guys a lot of questions, which I think is fine. But like, are you guys taught like trauma informed care? Is that also part of your work? And I think maybe okay. Is that
Yeah.
I think that's what it comes down to a lot of times is like creating a space of like safety and heldness when people, because like if you're going into a hospital setting a lot of times, like you said, you're vulnerable, you're going through things that maybe could cause trauma.
Mhm.
um like as people, as the providers, like how do we prevent that from happening, right? Because trauma can be prevented. Like how do we prevent that from being happen to happen? is always what I kind of come back to. Is like, how do we figure that one out?
It's
Yeah.
$1 million question.
Yeah.
Yeah. I mean, I think it's like the spaces have a lot to do with it.
Mm-hmm.
The levels of burnout,
Mm-hmm.
those seem like the biggest
Mhm.
things.
And
Yeah.
like as you said, like the patients asking for like what they need to, like what help do they need?
And I get, yeah, so for them to even feel like they can do that,
Yeah.
that's because often people don't. Or if they do, then they're just, I mean, they're a difficult patient. They're, you
Mm.
know, various things
Person.
because they're too high needs or high maintenance or something.
Yeah.
Um, when they're really just asking for their like basic humanity almost.
Yeah.
It's interesting.
Yeah, it is interesting. Just like sometimes I think it's funny that my job is to help people recover and come back to themselves after they've had like intensive medical intervention, and sometimes I like laugh to myself in my head. I'm like, what a funny job that I have, because it's like, is this job could this job eventually be like obsolete? Like that's kind of what I think about sometimes. Like, is there a way for us to prevent the trauma or like prevent the suffering if we have like we can change procedures on how care is provided? And again, I think I'm coming back to this like $1 million question. Um,
Mhm.
but yeah, I think it's like such a funny kicker for me that I chose this like profession out of my need to help people who've gone through similar experiences to me who didn't have like the guidance and the care and like the ability to have safe touch. You know, like that's
Mhm.
a
Mhm.
lot of what I provide is just helping people be able to receive touch in a way that doesn't elicit pain. You know, it's like we have full diagnoses for people who like get touched and it causes them pain and they just live with that for decades, years. Um, it's like where can we shift that so people don't get themselves in these really high states of suffering?
Yeah, I think a big part of it is like, well, it's cultural. It's like
Yeah.
you were talking before about pushing, like pushing yourself and what, like pushing your body. And in medicine, people push themselves, they push their bodies. In just general, like society, everyone's going so fast and like pushing themselves. And if we're all rushing all the time, like things are going to be done in a rushed way. And it's really like
We
a
need to chill
collective
out.
societal thing. Like I think people need to slow down. And for my for myself, like in my residency program, it was busy and whatnot, and sometimes I could hold space for people and sometimes I couldn't, and I would see this happening, and but I you can't give from an empty cup kind of thing. So
Yeah.
for myself, I took time before going back into practice so that I could feel okay again, because I want to be practicing from a place where I feel present. But I also know that that means I can't practice full time.
Hmm.
And so I don't know, it'll be different for every person, like finding like the balance of what works for you. But I think culturally, like collectively, we need to slow down.
Yeah.
And
Let me chill out. Can we all just chill out a little bit? Good for us.
Yeah.
Yeah. I think that's why I like shout into the ether, like on some of my like social medias. It's all about like slow down, like
Yeah.
find your breath. Like life is not that serious, not as serious as we make it up in here.
Yeah.
Mhm.
If
Yeah.
we can just like respond instead of react to things, I think we'd all be in a better space. Yeah.
Yeah.
I think that's a very, very true sentiment.
Yeah.
But it's so funny, like we have to teach that, Isn't that kind of a funny thing? Like that's where we're at. Like we're at the point where we have to like teach that again culturally.
Yeah, we're unlearning stuff.
Deeply, deeply
Mhm.
unlearning things. Yeah.
Yeah. What an interesting time.
Mhm.
Yeah. What an interesting time. Are this maybe we don't need to have this in the podcast, but are any of you guys into astrology?
Yeah.
I'm not deep into it, but I have people in my world who are, and they all talk about like the age of Aquarius that we're like entering into. It's supposed to be like a big time for like change.
The golden
Yeah.
age.
Yeah.
What is gonna happen? I mean, it's pretty cool. Like, I feel really like honored that I get to sit here with like two doctors and like hear you guys talk very critically about how medicine is being practiced. What hope? Like, that's like the whole age of Aquarius thing. Like, what hope there is out there to see like actual tangible change. Pretty cool.
Hmm. We both have the same birthday.
Oh my
Or
god,
me
really?
and you.
Yeah, we do.
February 8th.
Yeah, yeah, yeah.
Yeah.
Oh my
Coming
shit,
up.
I forgot about that.
I'm the 8th, but the opposite side of the year, September.
Oh, yeah. Oh my god, Ashley, it's almost our birthday.
Yeah.
Yeah.
Uh, yeah, I'm honored to hear your experience. Like what you've gone through is intense.
Thank you. It is
Hmm.
intense. It is intense. Yeah. Yeah, definitely intense. And I always wish I got to deal with it when I was older. I think that was the biggest thing. Is like I was so young when it happened.
Mm-hmm.
I remember my dad always telling me, he was like, just chill out, just like slow down, see this as an opportunity. And I was like, how am I supposed to do that? Like, I didn't
Can't
know how
use my hand.
yeah, like, my
Yeah.
body didn't know how to do that. Like, I legit did not know how to, like, relax and, like, slow down and, like, listen. I mean, I did because I was, like, I worked on that before all this happened, but I didn't have, like, the maturity to handle, like, the severity of what happened to me. I'm, I like, I don't really remember because I was blacked out for a lot of, like, my first surgery, but, like, the surgeons, it was so serious. The surgeons didn't tell me how serious it was because I was so young. They only told my parents the severity. They were like, she might not make it out. Like, that's a crazy thing to have to tell your, like, my parents had to hear.
Hmm.
Mm-hmm.
And, like, having to, like, try to reckon with that when I was, like, 23 was crazy. And, like, you probably know this, like, especially through residency and going through different, like, shifts or, like, areas of specialty. Um, People go through that, like, all the time, you know? It's like a like, some and a lot of people even younger than me have to reckon with these things. Um, yeah, it's like, as care providers, like, how do we help them reckon with these things that are, like, so hard to reckon with and so hard to understand?
Mm-hmm.
Like, how do we set the space? How do we hold the containers? Like, how do we allow safety to be had so it doesn't become traumatic? Because when
Mm-hmm.
things become traumatic, then we have like a whole other layer of like recovery and rehab that you need to go through, because then you have to do the rewiring part, not just like the physical rehab of things.
Mm-hmm.
Yeah.
I think, you're taking your experience and alchemizing it, if you will, into this thing that can like lift other people up who are going through that.
Yeah.
So you're doing it.
Yeah. I'm trying. I'm trying. As I know you guys are as well in your own ways. Yeah. Medicine's funny.
Yeah.
It's just
Yeah.
funny. Yeah. Yeah. It's just funny. It's like actually, like, we like did that internship together, and I was like considering. Oh my god, it was crazy. I was considering that stuff, like becoming. I don't think I ever really wanted to become like a doctor. I knew that wasn't my path, but just like working intensely in like the medical system. I still think I will kind of find my way back into it, but yeah, in a different way.
Hmm.
Mm-hmm.
Yeah.
Yeah, we need more of that.
Yeah.
That's good to hear.
Because we need to blend things together more.
Yes.
It's this and this,
In
it's
my
this and this.
language.
Yeah.
Yeah. But like, how do you see us doing that? Like, is there opportunity? Like, where is the blend happening?
I think there's opportunity.
Not to make you like represent the all of medicine. I don't
Yeah,
think
I mean,
you
I
are.
don't have a clue.
Yeah.
But it's like in communities, when you've done the work in yourself first, then you can um, work more in a more balanced way.
Mm-hmm. Yeah.
And I don't know that it's like a big like top-down system thing.
Mm-hmm.
It's
Individual.
more, yeah, it's a little bit more individual, and where there's strong community, that's where it happens.
It can happen. Yeah. I think we need both. Personally, I think we need both. Because we got it like the systems hold the containers for the individuals to be able to find, like, do the work themselves. But if you're in a system where that doesn't allow it, it's like, how will
Yeah.
the change ever happen? Like, even if like small individual changes of like like us three trying to do the work to find that like connection to our body and to ourselves so we can show up better with a full cup with people, like that's a wonderful change, but we need also like systemic change as well, I believe, in order for there to be enough of an impact, because some people don't
Yeah.
have the privilege to be able to like work on themselves for whatever reasons.
Yeah.
There's so many reasons.
Yeah. Yeah,
Yeah.
it's, I mean, by saying it's individual, I think it's not meaning to be like, we're ignoring all these systems or all of these oppressive forces that are holding people down, because it's like obviously so much more than the individual.
Yeah.
But individuals and places make changes in the places where they're at, is kind of what I
The
was
ripple.
thinking. But
Yeah, and when enough people are doing that, the things that don't serve people anymore will start to fall apart.
yeah, there's got to be a turning point, like at some point, or a tipping
Yeah.
point.
Yeah. And I bet you there's
Uh,
going to be many tipping points because,
yeah.
yeah. I
Yeah,
mean,
I heard that you can't, or that naturopaths are like illegal in Florida. Someone told me this,
oh my god, I can't
which
believe
just like I don't know. That's a systemic thing that doesn't really make sense. Like I
it.
don't know.
Florida doesn't. A
No.
lot of
Or
things in Florida don't make sense right now. Yeah,
never
legislatively,
been there.
Florida's going through it. Yeah,
Yeah.
yeah. I mean,
I think giving some of these systems less power, that's important.
Yeah,
yeah. Especially as I kind of work on more of like the outskirts of like what medicine and healthcare is. I think that's where a lot of people find a lot of solace in healing and like figuring out what like quality of life that they can get to and live at. Where it happens is kind of like when they let go, like let those systems have less power,
Yes.
or
hmm,
like they choose to find healing and health outside of a very structured like allopathic medicine or conventional medicine.
Yeah.
That's where a lot of that happens.
Well,
And
and
then go ahead.
it has to. Like
Yeah.
allopathic or conventional medicine isn't set up for healing. Like we break the body down into its parts, we diagnose, we treat, we do that. That doesn't heal. Like it manages symptoms. And I think that really needs to be seen for what it is. And
Mm-hmm.
then other work be seen for what it is too.
healing is like a creative process in a way. Like uh, the people who have helped me in my life, like in terms of healing, like mainly
Mm-hmm.
outside of conventional medicine, like some of the work, I'm like, could this even be standardized? I don't know if it could. Like it's like a creative, very creative
That's true.
thing.
Yeah, that is a
So
good point. And I mean, again, going back to like humans create like silly systems for ourselves, you know? Like
And then we believe in them. That's the wild part.
wholeheartedly, yeah, like
yeah,
that's fact. Like we make that fact.
Yeah.
Yeah. And just to push back a little bit, because this is something I think a lot about, is like my healing would look so different and maybe not even be at the place where I am now if I didn't have, because I would consider like my second surgery where I got that nerve graft, that
Hmm.
was healing. I mean, granted, it was like a experimental treatment, but that allowed healing to take place in my body. and it was really uncomfortable. Like, I remember when my nerve was coming, like, growing back in, and you know how nerves are. They send these crazy, like, signals randomly. That shit was so painful. Like, I
Oh,
had a
I
really,
bet.
like, painful bit when the nerve was, like, getting comfortable again, like, in the diaphragm. And that was, like, part of the healing. You know, like, I had to help myself understand that, like, those sensations, even from, like, bottom up, were painful. Top down, I told myself, like, this is healing, you know, like, this is
Mm-hmm.
me literally integrating my diaphragm back into my control center. What a crazy thing, you know? And, like, that's conventional medicine right there, you know? That's, like, experimental conventional medicine that did that for me.
Well, and it's also a surgeon that stepped out of what
Is
other people were doing
Yeah,
and was creative in their approach to
that's a good
that
lens, yeah.
situation almost.
Yeah, there's that creativity.
Mhm.
You know,
It's
it'd be
everywhere.
there it is, man. It'd be curious, I mean, not that he has time to chat because he's a surgeon, but it'd be curious to learn what his story is. I've looked online, he doesn't really talk about, like, how he came about this, but I wonder what his personal connection is, if he has one.
Mhm.
Yeah,
Yeah,
that'd
that'd
be
be
an interesting
interesting.
thing. That'd be an interesting one to look into.
For sure. Well, should we wrap it up there?
Yeah.
Uh,
Thank you so much for talking with us. It was awesome.
yeah, no, this was lovely. I really appreciate what you guys are doing to keep it up. Maybe as all of our careers progress, I can come back on and maybe give you a bit more, like, understanding of what I'm doing with pain care, as I'm not a little noob 2 years into it.
Yeah, absolutely.
Yeah,
Mm-hmm. Yeah, sounds like you're doing great work.
I think so too. I think I am as well. Sounds like you
Yeah,
guys
I've been
are as well.
following your Instagram and like it always whenever I come across one of your posts, it's like I pause and like breathe and take a minute.
Yeah, that's the goal, man. Take the minute. We all deserve it and need it probably, especially when we're
Yeah.
scrolling.
Yes. Yeah, the scrolling is the worst.
But it's all good. Like, we all do it. It's a part of our life now.
Yeah.
Mhm.
Yeah, yeah.
If you want, we can put your Instagram and whatnot in the description if you
Sure,
would like.
man. Give it to me. I'll take it.
Cool.
Yeah, please do. Please
What
do.
is it?
Huh?
What is it?
Oh, jeez. Okay. Yeah. Okay. So, um, socially, where you can find me, like, on the internet, my website is the most, like, more, like, in-depth thing in regards to management of, like, pain education, resources for people as they navigate the healthcare system and kind of come out of it and trying to figure out, like, now what? Like, now what the fuck do I do?
Mhm.
And that is just my first and my last name.com. So it's Claira Young, and Clara is spelled Claira, young.com. And then my socials, I'm on Instagram, just kind of providing what you said, those, like, daily tips to remind yourself to, like, come back to the practice of, like, connecting mind and body through the breath, through slowing down, through, like, kind of stopping the scroll.
Mhm.
And that handle is Your Body Works, and works is with a Z, not an S. It's
I
all
love
one
it.
word. And then I'm also on YouTube. I'm a yoga teacher, and I basically provide, like, accessible yoga and movement classes for people who are trying to get their pain into remission. So it's a lot about, again, coming back into the body. It's accessible movement. It's really slowing it down. I do a lot of focus work on, like, finding that, like, foundational core, that support system in your body through the breath and through, like, gentle activation of the abs. And again, the handle for that is just like my Instagram. It's Your Body Works, and the works has a Z, not an S. And
Awesome.
Awesome.
constantly updating those. That's what I'm doing right now.
Cool.
Excellent.
Well, thanks for being on here.
Mm.
Thanks for having me. It was an honor. I really enjoyed talking with you guys. Good conversations.
Thanks for listening.
See you next time.